Okay, good morning everyone from Jakarta and good afternoon from the other part of the world. I don't know where are you from now, but I'm based in Jakarta, Indonesia. Today, this is our third session for the causal pathway evaluation training, and our main focus topic of today is building understanding in getting ready. Yes. Okay. This session is currently being hosted by the Causal Pathways Initiative via an international network of evaluators, methodologists, philanthropic leaders, and others. Our aim is to build awareness, will, and skills among philanthropy, funders, and evaluation partners to use evaluation approaches that can make sense of causal relationships without depending on more traditional experimental and quasi-experimental approaches. This is because we know that many funders are interested in system change strategies, but it seems many fewer are not aware that there are methodologies that can help them understand if systems are or are not changing. Today we have two trainers here. Myself, my name is Yulianto Dewata. I'm based in Jakarta, Indonesia, and I've been an evaluation practitioner for the past 15 years. I'm currently focusing on outcome harvesting on my work. So my partner is Jeff. Would you introduce yourself? Jeff is facing. Okay. My partner is Jeff Matthias. He is an independent evaluator and currently based in New Zealand. I need to check my internet. If you cannot hear my voice or I'm breaking up, please let me know in the chat. Yeah. Okay, let's
We can
continue.
hear you, Julian. So it looks like
Okay.
Jeff might have had a technical issue and he left. So we'll
Okay.
just wait for
Awesome.
him to come back.
Yeah. Probably while waiting for Jeff to come back, we can pull up the poll, Carolina, to see who's in the room, your organization type, your role, and your level of experience with causal pathways evaluations. A little bit of additional information to get the most out of causal pathways efforts requires that everyone involved has some understanding of the approach in order to get the most of the process as possible. Causal pathways work isn't just an evaluation approach, it is a powerful strategy tool, and we have seen it work effectively as an ongoing evaluation tool in adaptive systems focused change strategies. We have seen it work well with active participation by people in the system, even children also involved in participatory system change work. Causal pathways work is also a journey that many are just beginning. I know from my own journey, it requires giving up some of my assumptions about how evaluations tell causal stories, about whether our traditional approaches that capture strategies, outcomes, and descriptions of context are truly making sense of causality and the complexity. So let's see who's in the room. We have a balanced participant from non-profit and for-profits. Okay, some of you evaluator, program officer, or manager, non-profits, program staff. Aha, so many of you still new to causal pathways evaluation, and a few also have learned, but haven't conducted one. I see you back in the game, Jeff. Would you please introduce yourself? You were out earlier.
Thanks. Sorry about that, guys. I'm not sure what happened. I'm Jeff Mathias. I was once a doctor. I was also once a stained glass artist. racial school in South Africa, and I was once a crocodile trapper in the jungles of Brazil. But anyway, now I'm an evaluator. Love what I do. Stuff. And you saw earlier, I can't introduce myself without introducing my wife. So that was the two. That was the two of us. So yeah, that's me.
Okay. Thank you, Jess. All right. Okay. Next. Yep. So this is the agenda and learning objective for today. Let's take a quick look of where we're headed today. Our focus is on building a shared understanding of causal pathways evaluations and getting more ready, both individually and organizationally, to do this work well. This means that surfacing some of the reasons this hasn't yet felt accessible or actionable, and identifying what it takes to help others move from curiosity to confidence. We're really glad to have this time together. And as we get started, just a few quick notes to ground us. First, this is a living training. We are continually learning and improving it, and we genuinely welcome your feedback at the end. And second, we will reserve time for question and answer at the end of the session. You are welcome to drop questions into the chat as we go, or jot them down and bring them forward during the discussion. If we cannot get to everything, we'll try to follow up afterward. And lastly, all materials will be shared after the session. So please, no need to capture every detail you see on the slides. You can stay focused on the conversation and the concepts. Now, regrounding in core concepts. We are ready to explore the causal pathways when we, in our work, ready to undertaking causal pathways work. And they describe this as having a couple of key components. So we are ready when we are starting to asking how, why, and for whom, and in what context is change taking place. This is different than asking, did we achieve our outcomes or what outcomes emerge? Instead of being lesser focused on what happened, we are asking why did changes happen, and if this happens differently in different contexts or for different people. The we is not just evaluators, not just program staff or other staff of funding organizations. It is also the partners on the ground, the people engaged in changing the system, including those in the system who are advocating and acting as part of the system change work. When we say we, the aperture can be very wide. Readiness also means that we are open to challenging our assumptions about how change happens, and that we are interested in emerging outcomes, whether positive or negative. When those orientations are present, we are then demonstrating an openness to learning, which is great, but it's also important that this is not just learning for learning's sake. Causal pathways evolution becomes powerful when this work is not an exercise in on itself, but rather what we are learning has a clear use that improves strategy and moves us closer to the systems that we are seeking to bring into being. In the previous training, we talked about the importance of causal pathways evaluations being grounded in our values. This is because our values inform and shape our areas of curiosity, the questions that we ask, the approaches and methods that we choose to apply, as well as the data sources that we deem important. Our values also inform who is included as an evaluation decision maker because they determine the scope, the questions, design, and implementation. All in all, our values thus inform how we plan and conduct a causal pathways evaluation throughout all its stages, which you can see represented at the bottom of the slides. And while we present the causal pathways evaluation process as sequential, most, if not all, causal pathway evaluations do not design all elements of the evaluation upfront, but rather making choices about methods and how to implement them as initial findings emerge. This flexibility and iterative process is critical for understanding how change happens. Okay, I'm handing over to you, Jeff. Please go ahead.
Thanks, Julianto. Well, let's start with a real example. So this is Afghanistan. I went there in 2023 for MHP is the mental health program of an organization in Afghanistan. Next slide, Julianto. And so it's a community mental health program trying to contribute to mental health in a, it's got Afghanistan's kind of got the royal flush of things that might cause mental health issues. It's poor, it's politically fraught, it's violent, it's internationally ostracized. It's a context with strong Muslim culture, low education, exclusion of women and ethnic minorities, stigma around mental health, low Western understanding of mental health, and very few resources. So there's quite a lot of reasons to have poor mental health in Afghanistan. Next slide, Leonardo. And I went there in 2018, so it's great to evaluate a place you've already been to. And at that time, a really committed and fantastic, she wasn't a psychiatrist, she was a physician from the organization, had responded to the mental health crisis from more than a decade previously, and worked. She was a British physician, and she worked along a Western medical model. And by the time I got there in 2018, had a mental health hospital, which was undoubtedly the finest mental health hospital in the country. It had consultants, it had registrars, it had a training program, it had play therapy, it had pharmacy, it was unbelievably good. They asked me to evaluate it, and I did, and I said, this is an unbelievably good hospital. But if you're poor, if you're not very well educated, if you're a woman, if you're rural, you just can't get here because it's too dangerous or too expensive, or you don't know about mental health or whatever. So amazing hospital, but it's not dealing with your values. And unbelievably, the organization said, okay, we'll hand the hospital over to the government of Afghanistan. Help us design a community mental health program that includes all those people, because they were all about inclusion. Just click there, Yulianto. Give us a click. And so the central hypothesis of the, just go back. Just go back. So the central hypothesis really of the case is that, and we designed it via outcome mapping, and roughly we're meeting identifying the key actors, meeting them where they're at, and then making contextually apt contributions to their behavior, attitude, relationship, or policy is effective, systemic, and it's our best way of contributing to an equity-focused and accessible mental health system where a Western hospital is not. That was the central hypothesis of the case. And the key, what they wanted about the evaluation was, has the mental health system, whatever that is, has it changed? And if so, how, why, by whom, etc. So all the sub-questions. But the basic question is, has the mental health system changed? We're evaluating something that no one's ever tried before. No one's tried to do a community mental health program in Afghanistan, and makes a lot of interesting things, including making causality very important. Give us a click, Ilianto. So what we did was a participatory, the picture bar on the right is actually, we did this participatory thing, and we drew system maps, and the men all drew these complicated system maps, and the women did these beautiful borders on them, and it was fantastic. Those 4 blocks that people are carrying as behavior, attitude, relationship, and policy. We did a participatory outcome harvest. Participatory means we had men and women from the NGO and men and women from the community, and you think about how mind-blowing that is in Afghanistan in 2023 when the Taliban said women aren't allowed to work. We gave some training and evaluation, and we refined the questions. We gave some training in interviewing, collected 378 causally focused stories, and I highlighted that, which they collected in the local language, Dari, and uploaded in Dari. The guys actually coded on, they did the coding in Dari. You'll see an example of this later on. And we did sense making with a community and NGO. Later on, it was translated into English, and some analysis and some fancy dancy fine tuning was done by me. But the guts of the evaluation was local people talking to local people and understanding from their point of view. And it wasn't just people on the ground. There were local women in compounds who I wouldn't even have been able to talk to, but also government officials and mullahs and NGO workers and a whole variety of people. You'll see examples shortly. Next slide. And we're not, so in terms of causal pathways, we had no illusions that it was going to be a simple A leads to B leads to C. We knew there wasn't going to be something like that. And if you just do a couple of clicks, what we knew was it was going to be, and another click, and another click. And there was just all this stuff going on, and there were going to be arrows and lines, and this causes that, but a little bit of this causes more of that. And we're totally expecting something like that. But we overall wanted to see if the top left, and we knew it was going to be a many to many causal pathways. It wasn't a one-to-one linear kind of thing. But a behavior change of many actors might lead to the bottom right, which is less mental health distress. So that's a key question. This is that early evaluation, a probe, if you like, in a complex system. How the heck does a system work? No one knows. What leads to what in this system? No one knows. Next slide, Julianto. And I just put that in. That was from the previous training, but we were expecting a system that looked more like that. Yeah, and give another click, Julianto. Okay, theory of change, which we love theories of changes, but what in complex system, how valid is a theory of change? So here really is actually what the theory of change of the project was. And if you click, Julianto. So we said if we do stuff to modify behavior, attitude, relationship, and policy of key actors, the key actors may change their behavior, attitude, relationships, and policy. And then click. Other people and organizations we think will probably respond to that, and click again. Other people will respond to that again, and click again. Other stuff happens, and we didn't know what the other stuff that might happen would be, but and then eventually the mental health system changes. And if you click again, you'll see what that's nested in, all that stuff. So that's the basic theory of change. Those words in blue amidst a whole relationship, a whole spaghetti bowl of causality around it. And I looked at and I welcome you guys to do it, at the training, the causal pathways training for the Northern Hemisphere. The example they gave was a much simpler cut and dried. It was not simple, a much clearer cut and dried. They roughly knew about what the causal lines they were looking for, where they might be. I deliberately chose this one because this is one where we didn't even know where the causal lines might be. But any of you who are in philanthropic organizations, I would encourage you to be bold enough to fund organizations that do this stuff. They won't be able to give you a really clear proposal because they don't really know. But if you manage to fund something that does what's on the top left there to the bottom right, you've done something amazing. The first initiative in a system of trying to deal with mental health where it happens. Wow, what a cool thing to do. Even if it's not nicely cut and dried and fits into all your boxes. If you're a funder, I'd encourage you to at least consider it. Next slide. And that's roughly what we had. And and again, it's deliberately messy. But what I've done here is I've highlighted I've put in red various key actors in the system, and all these ones in red were key actors with which the project had worked on their behaviour and what they did. PWMD, by the way, was person with mental distress. So that's a patient, if you like. Patients, their families. Shura is the smallest level of local government deals with kind of about 1,000 people there, local government. Really cool thing to get them involved. And there's mullahs and there's community workers and there's government and there's just basic people in the community. And the project worked with all them. And they have indeed done all this different stuff. And the one thing that I've highlighted in dark black there, a resource locally owned mental health centre with local staff, that really did become a focus, and a lot of stuff fed into that, and a lot of stuff fed out of that. And one of the key recommendations from this was, they were thinking if we do this somewhere else, what should we do? Make sure you work as they did very well in terms of a locally used mental health centre, which, by the way, the community things, possibly the coolest outcome of the whole thing was community people who waited till the end. And then they said, well, we're discussing our own problems. Let's deal with child marriage. And because they'd been modelled that they could solve their own problems in a community mental health centre, they talked about child marriage. And they, in a small section of Afghanistan in 2023, with the Taliban there, a community said, we will not allow any girl under 16 to be married. It covered a few thousand people, but wow, what a cool thing. And that came out of a locally resourced mental health centre. Next slide. And again. So really, what are the key questions if you're unlocking causality? And just click through them. There's 4 or 5 questions here. So when I go into this evaluation, I think what I need to do, and I worked with the guys there, because you'll see shortly the questions they give me, and I said, actually, no, I think we need to look at causality here. So we're saying, bottom line, have people's your key actors who you chose to work with, has their behavior changed? Who's responded, how, why, and what does that mean? What other stuff, this other stuff that happened? Is it about pharmacies? Is it about violence? What is the other stuff that happened? We know some other stuff did happen, but what is it? And then the big question in the end is the mental health, whatever the mental health system is it different now? How, why, and how did it happen? And then what's significant, in all this? So yeah, if you give me a click here, Julianto.
Sorry, Dave, hold on. Nothing. Okay.
Okay. And we're gonna explore a little bit more what actually happened, but this is the end of the story. Yes, there was significant systemic change and an attributional. We could attribute some of that, quite a lot of that actually, to the mental health program. Quite a lot, because no one else is doing anything in mental health. So, in a sense, this is a low-hanging fruit. And again, offering to you guys, whoever's a funder out there, to think the organization with an unclear cause theory of change and who's going out doing something new, if you do a little bit of funding, you might get quite a lot of gain from that, because the low hanging fruit, no one else is doing it. They don't know what's going on, neither does anyone else. But if they do a little bit, you might get a lot of results. And right at the end of it, and I'll put this slide here because this is right at the beginning, the women and men, because it's Afghanistan, they had to sit apart, and they were actually amazing that they were even allowed in the same room. By the end of it, here they are doing coding together, women and men working together. Amazing. This is Afghanistan 2023. The Minister of Mental Health turned up and he said, I've heard this evaluation's going on. I want to see what's happening. And I had a bit of a chat to him outside, and he said, I want to go inside and see what they're doing. And so he walks in. He's not Taliban, but he's got a big beard, and he is a psychiatrist. He spoke good English, and he walked in and everyone froze. The guy from the government seeing us working together as women and men, and he said, "Guys, just relax. I've loved what I've heard. Show me." And they talked him through their database, and he says to me, "This is amazing." And again, that low-hanging fruit thing. I want you guys to roll out this across the whole country. And this is a tiny little NGO that didn't have the resources for it. And we said, actually, we'd love to do that. If you can find resources to do the rollout, we'll give you the intellectual capital. We'll tell you how to do it. You guys provide the resources to do it. Unfortunately, just after that, just after I left, there was a big earthquake in Afghanistan, in Herat, where this was, and it kind of derailed a whole lot of stuff. But there was real government buy-in. They thought, wow, this is cool. The local team loved learning how evaluation ran, loved refining questions, loved doing qualitative research on computers, the whole thing. They felt really like this is great. And the community loved it because they had a whole lot of kind of local, just like them, not international evaluators like me, walking around talking to them about mental health and listening to their issues. And they felt, wow, this is our project, and people are interested in what we think about it. So it was a massive win all round. Next slide. So planning for it. And yeah, one of the key things that what we're trying to say here, it's kind of, especially for you guys if you're funders, but also if you're evaluators, if you want to do a causal pathways evaluation, it's kind of like a flick of a switch. You need to start thinking in a different way. And doing different things. Causality doesn't just fall out. You have to be a little bit deliberate about it. Next slide. And for simplicity's sake, and there's a lot more to this, where the Causal Pathways Initiative has put in 4 main things to think about. And it's not really lovely sequential stuff, A and then B and then C and then D. Stuff iterates and feeds back into previous stuff. And you guys all know how it is. But anyway, just for now, or for today, we'll present 4 of the major building blocks of a good causal pathways evaluation. There's the design and the evaluation questions, the method and data, and that, what kind of data, but also the quality and who gets it and how do you get it and all that stuff's involved. The analysis, what do you do with that data? And then saying, does the difference between a causal pathway evaluation, which says this is how we think this works in the system, versus a theory of change which says, a causal path, this is how we think this works in the system, and here's the evidence, versus a theory of change which says this is a priori how we think it might work, but that's just what we think. So what the evaluation does is it adds evidence. It gives you causal pathways with evidence. This is why we think this happens. Next slide. Okay, and I've kind of roughly said that already. This question: are we making causal inferences, and if so, how are we doing it? The idea that what we're trying to do is actually get real evidence for how the system changes, how actors within the system change, what works for whom, when, where, and why. And you'll get a copy of this, but all those dimensions to that are important. And all those dimensions are what an evaluator needs to do. You have to say, collect and weigh up claims. Are the sources trusted? Are we making causal inferences and are we testing them? Are we using methods appropriate for this? How much evidence of it? What kind of evidence is it? And ultimately, that thing which, as evaluators, we all love, we can make some evaluative judgments. That's why we're in the game. We like doing that. Next slide. Okay, so starting with evaluation design questions. Next slide. I got a terms of reference with, and you guys will have all known this, and I presented this last time as well, the DAC, Development Assistance Committee questions for an evaluation. And they had really nicely set out in their terms of reference, this is what you want to do. And as you know, the DAC question, what you may know, they're pretty common out there. They'd set them out into relevance, and there's all the sub-questions under relevance. They've got, I think, 6 major headings. Next slide. Effectiveness, and there they are. And they're all great questions that the people from the Development Assistance Committee of the European Union have, whoever they are, very clever people, have done all these questions, which are relevant to any project anywhere. Next slide, Giuliano. Impact. And there's a set of really good questions about impact. And next slide. Efficiency, and that's really important, obviously, for a funder. How well are our funds being used? So it might be effective, but are they also efficient? And again, some beautiful questions from the Development Assistance Committee. Sustainability, which is critical for any project anyone funds. And next slide. Coherence. So 6, Development Assistance Committee has 6 questions, 6 broad headings, each of which has 3 or 4 or 5. I think there's 22 of them overall, or whatever. It's quite a lot of questions. So you get a really comprehensive evaluation. Next slide, Giuliano. So just while you're there, and I presented these last time in terms of values, but I don't think there's anyone who was at the last session. But what I'd like you to do, just straight off the top of your head, give me 1 adjective and 1 number out of 10. The numbers are mark out of 10. How good are the DAC questions in terms of a mark out of 10? And give me an adjective. They're great questions. Just try to be better than great. Give it incisive or comprehensive or relevant or whatever, and give a mark. And I'll give you about 30 seconds. We'll just have a little pause, and then I'll give you my answer to the DAC. So 30 seconds and just throw them in. Don't think about it too much. Just let's make this fast. And Carolina, and I should just do a shout out while you're thinking about that, your one adjective and your number. Julianto and I introduced ourselves, but the only reason we can present this is because in the background, Carolina is doing a whole lot of stuff and organizing things and sorting out the disasters and doing all the stuff. So thank you, Carolina. And Carolina, I'll get you to well, what have we got in there in the chat? We got anything in the chat yet? Anyone been brave enough to say how good the DAC questions are? I'm not seeing any answers. Come on, guys, be brave. Wide 8. Thank you, Shirley. That's great. Shirley is first off the blocks. Want at least one more. Come on, Squirrel or Aurelia or whoever else is in there. How good are the development assistance questions in terms of an evaluation? 10 seconds and we're closing. Okay, no one's brave. Maybe no one's brave enough to say what they really think here. So here we go. Julianto, give us the next slide. This is my answer to this question. My one adjective is blah, and my mark out of 10 is 0. I hate the DAC questions. And in terms of causality, there's nothing causal about them. The DAC question is a generic question for every evaluation out there, and you just go through a tick box and you fill out these things. They're really great questions, but they're not designed for this particular evaluation right now. How does this system work? They're not designed for that. And you think, well, what is this thing? And there's no, it's just a preformed kind of idea. And the guys in Afghanistan, they hadn't had an evaluation before, and they didn't really know how to do a terms of reference, and they thought, well, everyone uses DAC, so we'll use DAC. But when we had the discussion with them, so we'll carry on. So I said, guys, I love your terms of reference, but I hate these questions. Let's talk about it. Yeah, next slide, Julianto.
Yep.
Sorry, I don't know how that happened. Next slide. Yep, that's it. So I opened this discussion. Javed's the guy in Afghanistan, and that's a lot of questions. And I might not have said gosh. Yeah, click again. So I said to Javed, well, what really are we? What's this evaluation really about? What are we trying to do? And we came, and this took me about a month of iteratively discussing with them. And we had some Zoom calls over team meetings, some were just with Javed, some via email. And we start saying, actually, what are we really trying to do here? Next slide. I've just thrown some pictures in of Afghanistan because I love the place and I think I love the colors, etc. So watch as we define these just by doing the questions. We go from an evaluation that might have been complicated to one that's looking at complexity, of an evaluation that was the DAC's all about accountability focused to learning focused, from broad DAC questions to becoming broad and deep, and program focused. DAC is all about the program, and it's for funders to think, should we fund this program? Whereas what we get with the evaluation questions is much more system focused and descriptive. DAC roughly gets an evaluator to tell them what's happening and what it looks like. Whereas what we're going to get here is questions would say, yeah, but why is stuff happening and what's underneath it? So that's all. Watch as it happens as the questions come out. Yeah, next slide, Julianto. So we worked with Javed, and this is the questions we came up with. Click. Oh, okay, sorry. This is so looking at how, why, and for whom, and under what conditions is initiative contributing to intended, unintended, positive or negative outcomes. That's done by the Causal Pathways Initiative. But I promise you that is exactly what Javed, when we talked about it, that's exactly what Javed said. This is really what we want to know. Obviously not in those words, but from the thing that Yulianto presented, it's not just about the evaluator or even the philanthropic organization. It's about the community and the guys on the ground, and the government of Afghanistan. It's about a whole lot of people who are also actually stakeholders in this program, and this is really their questions. They're not really interested in their questions. They're interested in this. Yeah, next slide. Okay. And stop there. Okay, so this is one of the key slides. Sorry, I just got a little bit out of. If you're doing a causal pathways evaluation, and that big in the dark blue in the middle, if you're really searching for that, there's a number of sub questions which Marina Apgar and Tom Ashton have and these are questions all about causality, and they've divided them into a whole lot of groups. If you ask me to do an evaluation, please don't give me all of those questions, because I'm going to say, gosh, that's a lot of questions, and I might not have been gosh. But out of these kind of questions, you want to pick what are we really interested in out of these questions. So first, you're thinking about what mechanisms might be at work within an individual causal link A to B, and how does that influence along the pathway? How do different contexts modify the causal mechanism? What contextual conditions enable or inhibit? How do local factors interact with intervention strategies? That's all about mechanism. How does stuff happen? There's pathway questions, which, again, remember, you're not going to give me all of these questions, but some of them are great. Or this is a smorgasbord. What specific processes led to the observed outcomes? How did the intervention trigger change? What intermediate mechanisms can connect interventions to, we did this and then someone changed behavior like that? How did that happen? What's along the pathway? And that idea of, can we conclude if A leads to B and B leads to C, does A lead to C? And it sounds logically obvious that must be the case, but it's not. If you think, for instance, it might be that in the north of the country, A leads to B. In the south of the country, B leads to C. But there's no part of the whole country in which A leads to C. Just to give you an example of why simple logic doesn't actually work in evaluation. Emerging causality, that's really, really important. Unintended consequences, what are they? How do they emerge? Are there unexpected causal pathways? And an emergent causality is a community dealing with underage marriage. Wow, that's amazing. And no one expected that. And how do a whole lot of multiple factors influence causality? There's impact and contribution inquiry. To what extent did the intervention cause the changes? Does everyone change or just some people? What difference does the program make compared to doing nothing? Basic question, but it needs to be asked. How much of the outcome can be attributed to the intervention? And again, in complexity, it's never just A leads to B. It will always be something else. If you guys think about why you've worn the clothes that you're wearing today, there'll be multiple things there. There's not a single reason why you've chosen the particular outfit you're wearing today. Comparative questions. If there were two different intervention strategies, which is more effective and why? What causal pathways did this trigger that didn't trigger? What are different effects from alternative interventions? How does the system change overall if this intervention? So if one's looking just at the pathway, one's saying, how important is that pathway to the whole system? And equity focus is how do causal effects differ across social groups? What variation and impacts did the intervention affect different populations differently? And systemic causality. How did the intervention contribute to system change, which is what this one was really, really about? What broader transformations happened, and how do multiple levels of the system interact causally? And that's, you're starting to get into the bowl of spaghetti when you start asking that. But there's times when spaghetti is really good. You'll get a copy of this slide of this slide set, and I think with those notes to look at what the sub questions are. As I said, there's a lot of questions there, but that's the kind of stuff you might be thinking about. You're not going to do all of those in a single evaluation. Next slide, Giuliano. Okay, and so here's in a general way what the questions should be about. It's about outcomes. It's about processes and combinations. It's about context, absolutely critical in complexity. Emergent or unexpected results. It's about differences, and it's about can we give evidence of A led to B? Did A really contribute to B, and did B to C? And can we give evidence that A to C in this situation is actually a valid causal pathway? So that's a kind of generic list of the kind of questions we're asking. Just checking the time. We're doing okay. Next slide, Julianto. If time's bad, I'll just talk even faster. It's a great technique. So the real questions to unlock causality isn't the 22 DAC questions. It's these ones, which I already presented to you, and this is the kind of stuff I was talking about over that month with Javed and his team. And then this is what Javed came up with, not me. Next slide. A million DAC questions became, and just click through these, Julianto. Look at that, five questions, 5 complexity-aware causal questions, and I'm giving that 10 out of 10 because there's 5 of them. I can focus on 5 things. I've got a small brain. I can't focus on 22 things, 5 things. But I'd say those are a lot deeper. Also, I think the process. They're 5 questions. They're not from the Development Assistance Committee somewhere in Brussels or wherever they are. It's from Javed in Herat and his team. It's their questions. So that's also part of the reason why it gets 10 out of 10. And I presented last time. So, there's causality in that, but that lovely last question. And that was really in the revised TR, what it said, just said, so what? Which for me is an evaluator. My heart sings when I see that, because it says to me, give us your evaluative judgment. I love it. Next slide, Julianto. And so now we're looking, this actually isn't the guys in Afghanistan, it's actually guys in Pakistan, but I like it that we're drawing a system map and they're looking at it. Now we're looking at causality, we're looking at learning, we're looking at system and how it might change, and we're looking at equity, all wrapped up in those 5 questions. We could get 5 questions from, leave aside the 22 clever people's development professors' questions from Belgium, and get 5 questions from Herat, and they've got all the magical stuff in there. Next slide. Okay, so you have some evaluation questions, and you've narrowed it to decide where to focus in the evaluation. You've got those lovely 5 questions. And now what? To finish, and then I'll be.
So thank you, everyone, and sorry about this. So what Jeff was doing with his activity, that he did train the team and community and evaluation, how to answer questions with data, etc., and how to interview the respondents. So this is also mentioned earlier on his slides that 378 stories of change of behavior were produced. 22 descriptors linked to every outcome. So this, if I'm not mistaken, this data, these stories of change were collected in Dari and written in Dari, and at some point they were coded and translated into English. Once Jeff is back, we can probably continue discussing about this, but I want to move on to the using bricolage in our causal pathways initiative evaluation design. Bricolage often happens through an evolving evaluation design as different evaluation needs to emerge. However, given increasing awareness of it as an approach for strengthening findings, It is now also being used as initiative evaluation design. Many of you are probably already familiar with using mixed methods approach. Now, bricolage is both similar and different. Bricolage of methods and mixed methods approaches share the same concept of combining different data collection and analysis techniques within a single study, but they differ in their flexibility and scope. Mixed methods primarily focus on combining qualitative and quantitative approaches, while bricolage is a more adaptable and expansive approach that allows for the combination of diverse methods, perspectives, and frameworks. To ensure quality and rigor in our application of bricolage design, we need to think through who is involved in each of our design decisions and in what ways. We also
You-
need to consider how we
Can
are
you hear me now?
applying. Hello, Jeff.
Can you hear me
Yes.
now? Yeah, okay.
Yes. Yeah.
Back.
All
And
right.
thank you for filling in for me, and apologies to all our participants.
Jeff,
It's
probably you
for me.
want to touch the previous slides because this is something like important. You were breaking out on this slide.
Yeah, okay. So
All right.
we did a thank you, and apologies. We did a participatory outcome harvest with realist theory testing and causal mapping. Causal mapping not done in the fancy way on computers, done in the traditional way of drawing things on pieces of paper, as you saw some pictures, but really, really nice participatory. And look at that, we got 378 stories of change of behavior, policy relationship, and with contribution linked into them. So interviewers, we practice quite a lot of this. If someone says something, how did that happen? Tell me more. Why did that happen? And we're exploring causality. Lots of descriptors linked to each one. And they practiced in a kind of realist theory testing. Oh, could it be that such and such, and they'd offer a hypothesis to their participant who would then confirm or deny it. It was all done in Dari and translated into English only at the end. So it was done very, very, very much locally owned. Next slide, Leandro. And yeah, this lovely thing that was the women doing a causal map, and then that's the team analyzing in Dadi on computers in the inset, and look at the change in dynamics in the team where now men and women sitting together, working together. Beautiful. Next slide. And Julianto has given you a lovely description of this in the of what bricolage is. It's somewhat different to mixed methods. They both use 2 or 3 or several different methods, but mixed methods roughly does something using, say, contribution analysis, and then something else using results-based management or whatever. 2 different methods at different places of the evaluation. Bricolage, which is French for mix and match, someone probably knows French better than me, actually implies improvisation, where the methods get mixed into each other. You're not doing one method and then another method. You're doing 2 methods together. And I love it because what it is, it says the principles of the evaluation are more important than the method. We're prepared to shift the method and move it around because that's more appropriate for the evaluation. Whereas traditionally up to now, now we're talking bricolage, but earlier, evaluators said, that's your evaluation. I'm going to force it into my methodological boxes. Now we say we can break our methodological boxes to make something that's appropriate for the evaluation. And I'll just put in those two those are real examples of my database for this. Shura is the local government, and we got many stories, as you see. But this is the kind of stuff where we're starting to see pathways of causality happening. The head of the local government introduced a local person to the mental health centre, and then she became a community volunteer. Child is much better, and now we're hopeful in the future, and now we refer. There's a system changing in front of our eyes, and those 2 little snippets are just anecdotes as 2 little snippets. But when you get them as, I think we've got 5,000 or whatever it was, a large number, then you can start saying this is data. Next slide, Julianto. And that's back onto you now. And apologies for my tech problems.
Okay, thank you, Jeff. Okay, everyone. Now I think it's time that we, because we like a small group. Yes, we're only small group, so we're not breaking into breakout rooms. But I would like you to reflect individually, jotting down your thoughts. Probably if you have questions, you can send it through the chat. And but I have a couple of things that for your individual reflections. First, probably we want to give you like 30 minutes to do some individual reflection and jot down some thoughts for yourself on the following questions related to an initiative or program which we are you familiar. It's like, what causal questions might you ask related to it? Which related causal pathways might you explore? And how would you exploring these causal pathways benefit the initiative or program? What would it make possible? So we have time. Time's now 1 minute past 11 Jakarta time, probably like 3 or 5 minutes. And you can probably share, open the microphone or putting in the chat. You can also use this time if you want to take a toilet break or grab your coffee. Where's my mouse? Okay. The last section is on causal pathways data analysis. Apgar and Aston suggest 4 steps for undertaking causal pathways. Here's the first one, participation. While these steps could be undertaken by the evaluation team alone, a better option is to undertake them in a partnership with initiative participants and other familiar with the context in which the initiative took or is taking place to help ensure that the evidence and linkages are accurately understood within their context. Many theory-based evaluation approaches that we use in causal pathways evaluation start with identifying causal hypotheses. Hypotheses about how changes came about. We need to look beyond articulated theories of change and more deeply explore each step within a causal change, where it led and how that change came about. During our planning phase, we need to anticipate the causal analysis we will eventually undertake. Through our causal analysis, we seek to understand what change happened, how and why it came about, for whom, and under what conditions. Through this analysis, we can test causal links that connect an initiative of interest to anticipated and unanticipated outcomes, as well as assumptions that must hold true for those outcomes to come about. Our analysis, similar to other parts of our evaluation, requires our reflexivity, our constant reflection on our biases, positionality, and power and how they are affecting our analysis. And it's a critical reasoning. We need to weigh supporting and contrary evidence within each causal link. Through this process, we should be able to discover the collection of actions, events, and other factors that contributed to a change. Testing those hypotheses may support an earlier articulated theory of change, call pieces of it into questions, help fill in the gaps it contains, and or suggesting entirely new theories of change to explain the change processes and outcomes we have unearthed. The first one, second one, the code for causality. To code for causality, we code not only actions and outcomes, but also links or pathways between them, as well as the context or conditions within which those links or pathways occur. It is worthwhile to spend a little more time discussing coding for causality. When we code for causality, we are coding data we have gathered from all of our sources, including people, documents, observation, etc. Coding for causality requires capturing causes and reflex, and also the causal link that connect them. Most of our software programs that we code qualitative data not designed to code for causality. We have a couple of choices. First, we can use a tool like Causal Map that is explicitly designed for this purpose, Or we can create causality codes, for example, non-profits as a driver for change, and code every time causality shows up within the date, allowing us to revisit it as we generate themes and patterns. We can also code our causal data outside of our qualitative data analysis platforms, including using tools like Kumu or even Excel to capture causal relationship. So let's look at the few examples here. This is sample of the causal map. Causal mapping is one way we're doing this. This slide shows an example of coding narrative data in the app causal map, linking statements where there is a causal claim that one thing led to another, or something happened because of a combination of factors. This was done manually in our case, coding inductively, which means creating factor labels based on what is said in an interview and building up a code book which is unique to data collected. This can then be fitted within an analysis framework, which links back to your hypothesis, seeking to test the theory of change of research question you started with. This is like a small one, but I will send a copy of the slide so you can have see the bigger version. The next one is an example of causal map looking at what were the cited drivers for improved food consumption, both quantity and diversity. The numbers on the line, linking boxes, represent the number of participants or other data sources in the evaluation who drew a relationship between a specific cause and a specific effect. While the numbers inside the boxes represent the number of participants or other data sources in the evaluation who discussed the cause of effect more fully. Access to financial resources was the most important factor cited by women in relation to the enhancement of diet diversity and quantity. The impact of the advice and guidance received via care group or other healthcare providers is cited more limited, as you can see on the slide. We have also another example here where I would offer to Jeff to discuss. All yours, Jeff.
Yeah, thanks, Yulianto. I'll just present this and I'll get you to, in a evaluation I did in Afghanistan, and look at the numbers there. Over 1,000 stories were collected, and I'm going to talk at the end how we did that. With a whole lot of interacting stories, a bit similar to the Afghanistan example, with everything linking like spaghetti. The story at the bottom right was from a woman, a mother, who's actually talking about, she says child, but she's actually talking about her daughters there. And we got hundreds of stories like that, hundreds of excerpts of that from interviews. It's basically a mother valuing her girl children's education. At the top left, it's about women who've using education to access the business world and start selling their own products. And the whole part of this came under the women's empowerment dimension of the program. And then there's right in the middle, there's a single story about one woman who did some amazing things and ended up in speaking in front of a crowd in the capital of the country, in front of people, which in a Muslim country for a woman from a village to speak is an amazing thing. And we can talk about this later at the end. And I'm just, as you just read those stories, how do we link causality? If hundreds of people are valuing their girls' education and tens of people are telling us that with that education, they're now doing things which are kind of empowering to women. Now they're handling money. And then there's a single story about a woman who's gone all the way to Islamabad and addressed a crowd about women's empowerment. I'm throwing this out to you as a discussion point. How do we analyze the causal links there? It's not quite A leads to B to C, but it kind of is. Let's talk about it. That's all from me on that one, Yulianto.
Okay, thank you, Jeff. So this slide is coding for causality. In this example, you can see the data is visually organized in Kumu. It's a systems mapping platform, and its cause and effect has one or more codes at the end of it, representing the data sources. Each causal link also has one or more codes associated with it, representing the data sources. The data is documented in Excel spreadsheets associated with the QMove visual, showing the data source and offering more detailed explanations. For example, 2014-I.C represents a key informant interview speaking about an event that happened in 2014, with C representing the specific line in the data, making it easy to reference back to it. Your coding method should follow what you're trying to accomplish. In this case, the analysis is using data captured through multiple methods, including an investigative journalism approach that results in each stakeholder speaking to a specific part of the overall story. And the story being told is about complex systemic change. A causal coding approach that mimics system mapping made it easier to make a sense of the data. In other cases, when there is a large N of similar interviews with common themes, the causal map software would be far more direct and useful to find the patterns. This might be true from an outcome harvesting approach where many different stakeholders are speaking about similar experiences and story of change. And the next slide, we also have another story sample from Jeff. I'll hand it over to you, Jeff.
Thank you, Yulianthal. And this is from the Afghanistan example I told you about. On the I use Deduce. This is off the Deduce database. The memo in the center, I had to click. Normally, you don't see that. You just see the transcript, which is on the left, written in Dari. All the highlighted bits are bits that the team, and you saw it, men and women sitting together saying, what does this mean? Is this? And I'd just like to add, as well as coding for causality, the data that's gone in, they've interviewed for causality as well. So you've got interviews for causality, which go into a database. Here it is in Dari. And then you're coding for causality and you're saying, what causal pathways can we find in here? And then I just pulled up the one in green there is the one I clicked. That's highlighted that one, and it's linked to a memo. They put all their English translations into the memo. So what they've said is, here's someone who's a person with mental distress. I have a job right now. All the people in the community are happy, which is basically being accepted by the community that previously stigmatized him, and that I have a job and work normally. And again, that's a single little snippet. And can you really say stigma is reduced from one little snippet like that? Probably not. But when we got 10, probably about 50 of those stories, similarly, of people offering jobs to people who were previously ostracized, what that meant to them. And when he says the community are happy, what he's really saying is they don't shout at me and throw stones anymore. I couldn't really understand that clearly, but the team, that group of men and women sitting together, totally could see what this man was saying. So there's an example of interviewing for causality and coding for causality in a participatory way, and you get really lovely stuff like that. Thanks, Yulianthal.
Thank you, Jeff. Thank you. We're going to the next one. Assessing the strength of evidence and making evaluative judgment. In the previous sections, we already touched on two very important parts of causal analysis. Having clear hypotheses about how and why change happened that way, happened the way it did, and having an approach for coding causality. From there, the next part of a causal analysis is to assess the strength of your evidence to begin to make your evaluative judgment. Okay, this slide, increasing confidence in causal arguments require careful and systemic analysis. You may zoom in on what you are interested in. For example, like show me all the paths from this intervention to this outcome. You can tell are the links in the paths, all of them from relevant and compatible contexts, which sources mentioned in which paths, or if some of the paths have more than one step. Were they mentioned in the same context but the same sources, or are we trying to include information from incompatible contexts? You may also explore alternative explanations. It's like within the data, are they compatible? Are they additive? Or are they rival explanations? They might be all true, but some are mentioned less frequently by less reliable sources than others. A priori, contracting alternative explanations which are not in the data. We can test the strength of each link in causal hypothesis or pathway with our multiple sources of data, seeking out both confirming and disconfirming evidence. We need to be transparent about how we and our partners we engaging are weighing, completing explanation. Some methods have very robust ways of doing the testing, such as the process tracing, and we can also use a brick-list approach to bring some of this rigor into other methods we use. Some methods have ways of testing causality built in. Process tracing, for example, has 4 tests that helps to figure out the strength of causal interference. This test contributes to both the confidence that a cause mattered and the extent to which it was sufficient versus necessary but not sufficient. Process tracing is also includes specific steps for surfacing and testing rival hypotheses. You can see on the slide, there are a variety of ways to make evaluative of judgment on the basis of your causal connections. Even if you then decide the evidence for a link is strong, you may ask, is that strong enough? Please remember that strength of evidence isn't the same as claimed strength of a link. Some methods have this built-in process tracing using something called hook test and smoking gun test. However, if we have built causal claims using methods in which this is not by designing embedded, then we may need to use another approach. In these cases, rubrics offer a useful tool. For those of you who attended the session on rigor and quality using a values-driven approach, the idea of using rubrics to strengthen the rigor of your evaluation should already be familiar. Rubrics are agreed at least to some extent or in advance of independently from the actual evidence. Our quality and rigor criteria define a standard we want to meet and the rubric operationalizes it. By using rubrics, we can clearly articulate the reasoning underlying our assessment and hold ourselves accountable for doing the best we can to implement our quality and rigor criteria steadily throughout a study. When we take time to assess our work against a rubric, we can see where we need to do more to better align our approaches with our quality and rigor criteria, as well as where and how these criteria show up. In rubrics, we can include the quality and rigor criteria that we use, standards that define levels of performance or quality for each criterion included in the rubric, descriptors or examples of what its standard looks like for each criterion included in the rubric. For more information, you can read also about Clarissa's use of quality of evidence rubric in the design note, which is posted on the Clarissa's website. The next slide is testing the causal explanations against expected outcomes. This evidence matrix provides an alternative way of presenting the causal data to show an overview of the differences between groups. This helps to answer questions about the extent to which intended outcomes were reported in each group and to what people mostly attribute change. The column on the left shows the main positive reported outcomes with the main attributed sources, drivers written in the corresponding box in each row. Deeper shaded boxes indicate that more women mentioned in the outcome, and a red border indicates that over 50% of women mentioned the outcome in the treatment group. This type of matrix helps us to isolate the main source drivers of change in relation to the expected outcomes. Useful if you are trying to see whether your intervention features as an important driver, but does not detail how. For example, causal connections along the pathway, and it doesn't consider rival explanation. This is where triangulation is important. Triangulation data itself is one of the ways we strengthen our testing of the causal relationships and how consistent they are. We are looking for evidence supported by multiple sources. Multiple sources of evidence associated with its causal claim. You may want to have evidence from multiple sources, perspectives, points in time, data collectors, etc. that may support its causal claim. Coder and analyst biases. Through this whole process, we need to be aware of and manage bias and how data is collected, coded, and analyzed. This involves ensuring that our data collection and coding tools and processes do not favor certain theories of change, and that in our analysis, we are open to finding all sorts of actions, factors, and events contributing to multiple anticipated and unanticipated outcomes in different ways. One final note on how we assess the strength of our causal claims is while much of this can be seen as the work of a research team, ideally we are exploring and testing these causal claims with our stakeholders and partners. Sense-making sessions together with initiative participants and others affected by an initiative are one more place and way of testing causal claims and strengthening them. We are not merely discussing patterns, but we are investigating and interrogating causality together and the implications of what we learn from doing so. This type of learning and use need not wait until a full study is done. In fact, stakeholder sessions that test causal claims can be both part of the data collection process and offer meaningful sense-making and use moment for the participants. As Jeff mentioned earlier, he has like more example about this that you can see on the next slides. Over to you, Jeff.
Thanks, Yulianto. So this is actually from Afghanistan and that idea of group sense making. So we first said, I presented at the end of the evaluation, presented the database and then got their map at the beginning and said, how do we think what links to what? And that process, the actual discussion of what's going on and what the context was incredibly rich. But we didn't stop there. This is inside the NGO office. We actually went out into the community and said, this is what we think is happening. What do you think? And we presented all these hypotheses and got them to tell us what they thought was going on. And in complex situations, and I presented this case as a very complex situation for mental health, but also a situation that no one had any idea how the system worked. Actually, people do have an idea. The people in the community, they can tell you this bit of I know about this bit of the system. This is how it works. So this is part of that idea of actually saying, is this, how strong is this evidence? And if you just click, I'll just carry that discussion on.
Yep.
That question, how strong is the evidence? This is off my dashboard of my Deduce database. And just to tell you the media count, that's 378 stories. So we had 378 stories. Descriptor count is really important. Remember in Causal, the whole thing was saying what works for whom, when, where, and why. Descriptors 378 means that every story had descriptors linked to it, which was 22 of them. The descriptors we had linked was things like what social group did this person come from? What ethnic group did they come from? What age? Were they male or female? Were they high, medium, or low socioeconomic? Geographically, what area? 22 different things. So that question, every outcome was linked in the computed. So we could ask questions like, do the poor women in this province is it this only the poor women in this province do it, or does everyone do it? Those kind of questions. The who does what. So this Deduce is really nice for that. It links descriptors to the outcomes. 378 stories had 1,533 excerpts. Excerpts are what I showed you in that last slide, where they've highlighted a significant part of a story. So each story had kind of average of about 4 key bits in it, but some of them obviously had more and some had less. we did inductive coding, so we let the data tell us what the codes were. We ended up with 189 codes, which again in deduce, that sounds like a whole lot, but we had them structured in a code tree under different participant groups. This is from women, this is from men, this is with people with mental health disability, this is from government officials, and then each of those was sub-classification under those. So we could actually look who's showing what outcomes, what kind of person is it, and where, and then the code applications, how would we apply the codes into those 189 code trees, 5,600 applications. So in terms of a strong analysis, or is this robust data, what I presented to my funder was who I said, well, I haven't analyzed this, but these are stories collected, causal stories collected by people from the community and the NGO, including women. This has been analyzed in groups by men and women sitting together. So you get that discussion, what does this really mean? So you get less chance of someone's personal agenda derailing the story. This is then being presented to the NGO as a whole for us to think about. We've then taken that to the community to say, these are some of the theories that we think is happening. And it's all based on really quite large numbers. So that whole process, I think, and the funder was really happy with that. They said, we're really, really happy with the strength of evidence in this evaluation. So yeah, I just wanted to present that as just those two slides as showing a stepwise approach to actually saying, how good is this evidence for causality? And I just want to reiterate once more, right at the beginning, you have to interview for causality. You have to have causal questions, and then you have to ask about those questions. If you don't do that, none of the rest of it really works. That's me, Julian.
Thank you, Jeff. I think you can also continue on this.
Okay, questions and comments. Any comments, questions, ideas? Shirley, you had one interesting one that I just flicked a reply to. If you're happy to do it, would you unmute yourself and just ask that in your voice?
Thanks, Jeff. Yeah, I just wanted to know how we can handle issues of representativeness and credibility of information we get out of using some causal pathway analysis approaches, because if we have, for instance, a multi-country program going to different countries and we want to study about it, we may not have all the resources to go to every country to do that, yet there's much focus within the causal pathway analysis methods on the context within which the program or the intervention is being implemented. So the countries might have different contexts. Maybe ideally we should be studying all of them, but there would be quite many sometimes. Over 20 countries, maybe 30 countries. How would we handle that issue in terms of deciding which countries to include and how many, which countries to include and how many of them should be included? So that's one of the questions that I had. Thank you very much.
Shirley, what a fantastic question. And this is really where the rubber meets the road. We have all these ideas about causality, and at the end of the day, we have to say, what are our resources? What can we actually do? What's feasible? I'm thinking on my feet here. Shirley, what country are you in?
I'm in Uganda.
Okay. So one of my basic principles of complexity is I think context is really important. So it's very difficult to make causal claims about a country if you haven't got data from that country. However, and I'm only thinking on my feet here. So if I had some time to work through this, we might come up with something different. The way, let's say you're in Uganda and you're trying to make an analysis of a program. Let's say you said 20 or 30, let's make it 20 countries, which is quite a lot. And you've only got resources to go to 5 of them. How would you do that? And I would invite everyone else to think on their feet as well and give me different answers. My answer off the top of my head for what I would do there is I picked those 5 to be as diverse as possible, so as representative of the countries that of all 20 as you can. So don't pick all 5 East African countries when you've got some West African countries. So you pick as diverse a group of 5, and then you do strong causal pathway analysis in those 5, figuring out what the causal pathways in those and what the key contextual issues involved in those causal pathways are. So a lot of those mechanism questions, when I presented that slide about the different, how Marina and Tom had analyzed them, you'd be keen on doing mechanism. You'd then come back with your 5 countries and you'd start forming some hypotheses, and you'd be looking at them and saying, what do we see in the 5 of the causal pathways we have? There's some causal pathways which we only have in country A and B, and others which we only have in B, D, and E. But then there's a few causal pathways we have in all 5 countries. We think these might be generalizable causal pathways. So you do that, and then you'd have to have, and hopefully you've got some partners on the ground at least in the other countries, and you'd get them to. And I'd probably use realist evaluation interviewing for this. You'd have to have someone who can, if you don't go to the country yourself, someone who does some interviews along the lines of testing those theories that you thought were the generalizable theories from the program. So that's a very quick answer off the top of my head. Anyone else is welcome to unmute and give us their answer to that very interesting question. Thank you, Shirley.
Thank you, Jeff. Let's see if there's any questions. Nothing. I think we also have, Sally was asking software that was being used to analyze and organize such data with numerous links. I think that's the Causal map website. Yeah, Jeff, if I'm not mistaken. Numerous links.
And just while Yulianto's looking for that, carry on.
Yeah.
I've got an idea here. Again, this is off the top of my head. Just like we've been talking about bricolaging methods, I reckon we can also start bricolaging our online tools. And I can imagine using the same evaluation, using Causal Map, which shows the pathways beautifully and how many, and using Deduce, which is what I used for the Afghanistan example, which looks at the linkages between various things. And I think the 2 of them together could make quite a good causal map. So this idea has just come up to me right now. We should start thinking about bricolaging our tools as well as our methods. And Yulianto, you can tell us what the causal map website is. Oh, I think Carolina just sent it.
Yeah, it's on the chat. Yeah, thank you, Carolina.
Yeah, so
Okay,
yeah.
Yeah.
Any more? Just maybe use the icon. You can stick your hand up I'll give you a minute just to, you've got some time.
While we're waiting for the questions, I think we can go to the next slide where if you people want to explore more about the causal pathway, so you can head to our website. You can see on the bottom, yeah, the causal pathways .org. As part of these activities that we have been, I think this is our 3rd session for Asia Pacific, to do presentation and trainings to build understanding and will. We also have been participating in several conferences for the past few years. We also have on our website resources where you can see some example of our case studies. We also have a book chapter that you can access online. And we also have the learning and acting together with support. So if you need any support from us, you can email to Carolina. So, we have some kind of a name, Brain Trust, to help funders work through tough questions with field experts. So it's something that we can help you with.
And I'll just say, Shirley, your question would be an ideal one for the Brain Trust to throw some ideas in.
Yeah. Yes.
Thanks, Jeff
Yeah.
and Yulianto. Thank you very much.
Thank you very much. This is a sample of the website. So we also collaborate with Better Evaluation. Some of our materials and example cases, case study also uploaded on the website.
Yeah, thank you very much.
You?
Thank you so much.
Okay. If you have time, please fill in the feedback.
And we've still got time. If you want to ask any other questions, you're welcome to.
Yep. We're not running out yet. Yeah. Kafayet and Habibullah, I was wondering, where are you from?
Uh,
Well, I'm from Nigeria, but I'm based in the US.
Oh, it's midnight here then. Habibullah?
Thank you, Devata. I'm from Afghanistan.
Aha.
And I'm wondering to share my expertise in knowledge. And I have been working in research, but not so much at a deep level. And I have been trying to do a research on female-headed households in Afghanistan. And unfortunately, due to these troubles that continued over decades, specifically in this current situation, there are a lot of restriction on data collection. And I'm wondering how when we are assessing the strength of evidence for our research, so in such situations, how can we ensure or assure that this evidence is credible for conducting a research or making the causal pathway analysis for that? For example, like female approaching female specifically in this situation, in current situation, is a bit sensitive. And as the Jeff has been to Afghanistan, he understands it well. Even here we have cultural restrictions, and unfortunately we have got hundreds of thousands widows, though, who are responsible for their family's livelihood. And even due to cultural constraints, we cannot approach them. For example, there is a widow, some kids, and here in Afghanistan, we have got a big family structure, like many brothers live together, and one of the brothers is died, then the other brother will not fully support that family. Besides, they will not expose that widowed sister-in-law to other people to approach and support. So these things make data collection so much challenging. So to make it specific, how in such situation, how we can assure the credibility of these evidence or data we collect from the field.
Habibullah, I think there's no single easy answer for that question, but if there's a way to do it with community participation, obviously it's difficult for you to speak to women, but maybe other community women can speak to women. So is there a way to organize community participation as part of your evaluation? Can you give them the training? Is there a way to have some women in your evaluation, on your research team? Those kind of questions, but I know there are no easy answers. So I completely understand how difficult it is. But amazingly, that was 2023 when we did that evaluation in Afghanistan. The Taliban actually gave us a dispensation. They said, "Yep, women can work in this evaluation." So there's more possible than what we might imagine.
Yeah. Hello.
Thank you.
Can I say something else?
Yes,
Please.
please.
Yes, I wanted to contribute and say that what Jeff just has said is what I wanted to say. That even in countries that don't have such cultural restrictions, such as in Afghanistan, like in the agricultural field, it is often the man that has how will I say, that is normally interviewed or that receives extension services, most. And then later on, you see that you have a lot of women who are also coming into the agricultural extension work, and that makes it easy for data collection from the women who are working in the agricultural sector in developing countries in Africa, to be interviewed, for them to collect data from them. So it's the situation is also very much in other parts of Africa where you have Muslim, let's say where you have Muslim dominated populations, and the only way to do that is to have community participation, and ideally within your own organization you must have some women, that you'll be working with that will have access. Oh, sorry, that would
Okay.
sorry, that was the alarm because of some cooking my daughter was making. So I think ideally you need to have some women that you can work with that will have access to the women. That is the only way you can collect data from them. If the government would not allow you, maybe you should try. But I think you would have some women, you must have some women within the organization that you must have, you can be trained, and then you can use them to get such information from them. I think that's the only way to go around the data collection. It's something that doesn't require so much of a, of I would like to say so much of solution other than looking inwards on the resources around you. Which women, maybe bodies of social network do you know of, and how can you get a link to them and explain the purpose and get someone to train them? So that's just the only way to go around it.
Thank you, Kafayat, and thank you, Jeff. Yeah.
And Habibullah and anyone else, Carolina is going to send you a summary of this, which will have my email on it. You're all welcome to contact me by email, get my 2 cents opinions on anything. I'm very happy to give them. They're not based on anything, but
Yeah.
I'll give you an answer to anything you ask.
Okay. Yeah, 5 minutes. I mean, like, do we have anything? Questions? Pula. So we have Sudarat. Do you have any comments or questions? Please open your microphone. If there is no more questions, Jeff, I think we can conclude this discussion. Oops, wait, there is one in the chat. Oh, thank you. I would like to info. All right. Thank you. No question, but would like info on next training. So I believe that we have a regular newsletter bulletin sent out to our partners that hopefully we will have more information about it. Yeah. Oh, Carolina, if you want to add something about next plan of training, but
Yeah,
I
in
think it's
terms
not
of
going to
these
happen. Yeah.
trainings, this is number 3 of 3. But we do expect to have some coffee breaks over the next couple months, which will be shorter, really focused case examples, very relevant to some of the content you shared, that both Jeff and Yulianto shared today. So be on the lookout for that. We are planning on having one before the year ends. So that's something to look forward to.
Okay. Thank you, Carolina. So thank you everyone for joining in. Hopefully, looking forward to see you again sometime in the future. All right. Thank you. Bye-bye. See you.
Thank you so much.